Okay, so hello everyone. Welcome to our latest Still COVIDing chat. Today you are here for What is in My COVID Box 2026 edition. And I know some of you may have been on a Zoom that we did in the way back, I don't know, probably around 2021, 2022, for what was in our COVID box. And so I just thought with all the new kind of things that have been updated, everything, the last time we did, I don't even think we had Paxlovid yet, maybe. So it's been a really long time, and I thought it might be fun to just have a peek at what's in my COVID box, and then we can all talk about, maybe what you have in yours, or any questions that you have. So the first thing that I want to show is like, what is a COVID box, right? Somebody asked me the other day, well, what should be in my COVID box? I don't know. And so a COVID box for me is just a little, a Tupperware kind of container with a little Loctite lid. Actually, my COVID box could probably be a little bigger. I'm going to be working from two tonight because I kind of share COVID box with my youngest. If you expect to have to take care of a smaller child, then probably having your COVID stuff like together might make more sense. At least it did for me because I knew that she wouldn't really be able to kind of manage the things that we would be doing in the schedule and be on her own if she has COVID. So hers and my stuff is kind of combined, but I thought it might be good because you can see kind of the kid version and the adult version, even though ours are kind of jumbled together. But for someone who's not sharing, one of these little boxes is probably pretty good, unless you're kind of you know into way overkill, maybe like I am too. Now, I have to tell you the caveat: we've never had COVID at my house, and so I know that we've had lots of other illnesses over the course of our years, and we are a chronic illness family, and so I do know that sometimes what you think you're going to do when you're sick is not exactly what you implement when you're sick. But having dealt with a fair amount of our own respiratory viruses and those kind of things, and kind of being prepped for it, this is what I have planned if we were to encounter COVID in our house. And I'm going to kind of fly through the basic stuff. I know that probably nobody here is brand new to this, and everyone kind of knows basics wise what they have kind of put together. But I wanted to talk maybe a little bit about some of the less conventional stuff that I might have in my box as well. Um, Now, I should tell all the disclaimers. I am not a doctor. I don't play one on television. I'm not your healthcare provider. I can't give you specific medical advice. You have to check, and double check all the stuff that I'm showing you and make sure that you don't have any medical contraindications for it, that your healthcare providers are on board with these things for you, and that you've checked any drug interactions or anything like that. Because, of course, everybody's different. And even in my house, we have a little bit of a different flavor to some of the things that I'll talk about that are in our boxes because of our own particular medical profiles. So all of those disclaimers, I'm not telling you what to do. I'm telling you what I do, what I'm going to do for my family. And then, if you end up extrapolating from that, then of course that's all well and good. So, starting off, I'm just going to kind of go through some of the basics that I think everyone probably already knows and has, or at least hopefully everyone already knows and has. Of course, in our COVID boxes, and my Zoom's doing something funny. Can you guys, are you able to see what I'm showing you pretty well? Because like I'm tiny on my own Zoom screen. Okay, you can see it. Thanks, Georgia. All right. So the first thing that's in our COVID boxes is Paxlovid. And we do plan on using Paxlovid. I know that the studies about like long COVID prevention are not super encouraging, but definitely Pax is something that I feel like will keep us out of the hospital. I do feel like that it is a tool to reduce the viral load. And you'll see a lot of these things that I'm going to do are going to be to decrease viral load, to decrease inflammation, and then also to try to kind of cushion us as we come out of this for the dysregulation that I'm going to expect. I expect 4 months of immune dysregulation, going down to a nadir, and then I expect our immune system to come back up, hopefully to its pre-COVID state within the next 4 months after that. So it's about an 8th month immune dysregulation. We also have some particularly tricky stuff with our immune systems, and so I'll be talking about that a little bit too. But I'm going to be doing anything that I can to reduce our viral load. Now, if we had some contraindications or other medications that we couldn't do packs with, then I would be looking at, molnupiravir. I'm not even sure if I'm saying that right, but the other antiviral alternative, because I do think that antivirals trying to bring that viral load down are going to be helpful. Now, it is worth noting that for, the people in my family that have higher risk profiles, I don't have one PAX box, I have two. So I have a 10-day course because the evidence originally with Paxlovid was for a 10-day course. And then, there was a shortage, if you guys all remember, and they said, oh, there's no way we can get everybody 10 days. And so they kind of cut the duration to 5 as like the least efficacious period. But at my house, we have, some people that have higher risk factors for one reason or another. And so I want to make sure that we can all do a 10-day course, with the exception of perhaps the young one. My youngest is 11, so she's not quite of Paxlovid age. But I do have a PAX box that I set aside for her. And I would probably only do 5 days with her. I probably wouldn't do the full 10 with her because she doesn't have some of the trickier things that would do that in because of her age. But everybody else in the house has a 10-day PAX script. How far past expiration would I use it? That is really a great question. And if we just have a few questions as we go, I'll just talk about them as we go. Antivirals post expiration date, they kind of make me a little nervous. I wouldn't worry about it if it's like a month off or a couple months off. I don't really know. And I've tried to look this up. And of course, there's not really great data out there saying like Paxlovid is not really in that Army list of all the things that they reevaluated the expiration dates on and found that most things, with the exception of liquid antibiotics, and then some specific cases like tetracyclines that do go bad, most of your medication expiration dates, you still get efficacy afterwards. It's just kind of decreasing the older that the medication gets. And I know too, like if for some of my other things that we've used medications that were, several years old and they still work and they're fine. I would be hesitant for PAX, but then again, it's kind of a risk benefit thing you're weighing too. If you can't access it, then that's, I think probably maybe having an expired medication versus no medication. I don't know of anything that says that it would be like dangerous as it's expired. The danger would be that it's not efficacious, is at least what I've found in my search. Paxlovid now $1,500 are expensive for most insurances. I think that's just going to vary. Right now, we used to have $100 copay on Pax in my insurance, and for some reason, all of a sudden this year we went to no copay. So I don't even have a copay on Pax right now with my insurance. But I know some people are seeing larger copays. So that's going to be very plan specific. And most of the resources that I know of have dried up to get PAX, at low or no cost. If you know of any, please, of course, share them in the groups in the chat because, we would all like to know how to get it cheaper, but I don't really know of any of that. Honestly, again, I'm just telling you what I would do, probably. I'm not telling you to do this. But, if I had a really high copay on my insurance, but my, brother or my son or my friend or my nephew's uncle's aunt's cousin didn't have a copay on their insurance, and they wanted, to have, if they probably might have been exposed and they might have need some packs and then they might decide against taking it and leave it at my house accidentally, then that would be okay with me. But other than that, I don't know of any like copay programs or resources right now to get it cheap anymore. That I just haven't seen them out there. Now, that being said, is PAX the be all end all? I don't really think it is. I mean, I think it's a great tool, but I do think we do know we have other tools now, other things that we can do, and we've never really been able to access PAX for kids. So, like, it's not like it's the only thing that we can do to decrease our risk, or the only thing that is even kind of safe to do. But it is in my box for my family. Now, I did make a little kind of cheat sheet note here. And if you guys see something else that you think, because I didn't make this like a comprehensive list, can you see my little what's in my COVID box note that starts with metformin? Okay, cool. So I did put a little bit of information in here though about some of the other kinds of major things that would be kind of asked for your healthcare providers because they are prescriptions and you can't get them without them. And one of the big ones for me is metformin. And so you're definitely going to find metformin in my COVID box. And I'm going to give it to my 11-year-old too. Metformin FDA approved down to age 10. So that's something to know. But metformin, actually was the thing that we have that it looks like could actually really help with preventing long COVID. And so anything that we can do that gets us a reduction in long COVID. The first study, I think that was the first study that I have on there from 2023 that showed a 40% a reduction in long COVID risk for metformin. For later on, there was just another study that came out this year, and I apologize that I didn't go pull it, but the first study was for people with high BMIs, and the second study was with people for normal weight, and it replicated the benefit. And so I do think that metformin is a good add for my COVID box. Now, the dosing in the study right here, it was titrated over 6 days, was 500 milligrams on day one, 500 milligrams twice daily on days 2 to 5, and then 500 in the morning and 1,000 milligrams in the evening up to day 14. That's the way they dosed adults in the study. If you're dosing a kid, you're probably going to want to go lower. The major kind of side effect of metformin is it can cause GI distress. And when you have COVID, it's kind of hard to tell because COVID can also cause GI distress, whether your metformin is causing GI distress or your COVID is causing GI distress. So you do kind of have to keep that in mind. But you could. This is what the study did. This is where the efficacy was demonstrated. But you would definitely adjust that dose for kids, and you could also adjust that down if you felt like your GI side effects were related expressly to your metformin script. But I do have metformin in my COVID box. The next script med that I have in my COVID box is fluvoxamine. And this is Luvox. This is an SSRI. Now, if you're already on an SSRI, you're not going to want to combine it with Luvox because then you're going to be double therapeuticing yourself. Even though Luvox is kind of the one that showed the most benefit in most of the studies. And I will tell you that Luvox that I've seen, I work in healthcare, and in our clinic, we do treat long COVID, and I have seen Luvox be super helpful for long COVID brain fog. And that's really why I would be using it, is to kind of give me some of the neuroprotective effects of the SSRI. Now, I'm not on an SSRI regularly, so again, check with your healthcare providers, check your current meds. But Luvox tends to be helpful, I think, and you don't have to stay on it for a really long time. I would keep my kiddos on it probably just for 2 weeks, and then I'd let them come off. If they started feeling brain foggy, I might put them back on for a little bit longer, and then I myself would start it at 25 milligrams twice a day for 7 days, and then I would increase it to 50 milligrams twice a day for the next 14 days, and then I would come off of it. And see, I have some friends that have taken it, and they kind of liked the benefit. Not most of them, but some of them, instead of stopping it at 21 days, they actually went another 30 days, and then they were able to kind of drop back and come off of it, because it really, really helps with kind of that brain fog and clarity that COVID can bring. So Luvox is also in my COVID box. Then we have just kind of the basics. This is just one of the studies that showed that Luvox actually showed reduction in the risk for being admitted to higher level care. So going to an ER or being transferred to a higher level hospital. It had an absolute risk reduction of 50% and a relative risk reduction of 32%. Now, there are some conflicting studies, though. There were some later studies that said, well, it didn't really show that much benefit. And then there were some other studies that said, yes, it does. So as of right now, I think it was the National Institute of Health says insufficient evidence, yes or no. But having, seen personally what it can do for some people that I know, I'm still opting to use it. And then for the adults in my house, we'll actually be taking 325 milligrams of aspirin because that, is going to try to help prevent that clotting and coagulation stuff that comes with COVID. And a lot of the sequelae, of course, they seem to be finding out has to do with clotting and microclotting. And a lot of the labs for post-COVID lab stuff you can see come from, kind of that elevated clotting risk. And so 325 milligrams of aspirin daily, at least for adults. They do make baby aspirin, of course, that you could do for kiddos if you've felt like that their profile kind of warranted it. And then the other kind of prescription med that's in my box is Tessalon Pearls. And these are for grown-ups. So I'm looking in my kid box. They are for grown-ups, but the Tessalon Pearls actually are just for a really bad cough. So it's a cough suppressant that I think people have kind of forgotten about. It can be a little sedating, so they don't really use it for kids. But if you're just hacking your head off, one of the major things that's really important, of course, when you have COVID is that you can sleep, and that hacking cough, if that's the kind of COVID that you get, will definitely not let you sleep, and then you can't heal as well. So I've got Tessalon Pearls here, and again, this is a script you'd have to get from your doc. Hey, can I have Tessalon Pearls? I've really got this hacking cough. Most docs don't have a problem with doing that for a cough. Then I'm going to go through kind of the other common prevention, but since I'm hitting prescription drugs in my boxes too, because of our particular profile, if you have any kind of autoimmunity or if you have any kind of inflammatory propensity, any kind of rheumatological stuff, the first roughly week of your body's fight against COVID is when the virus is replicating and you really don't want to do anything to kind of suppress your immune system because you want your immune response to fight off that viral replication. But when you hit about day 8-ish for most people, you flip into an inflammatory phase. And so if you already have kind of an overactive immune system or some kind of condition that would predispose you to immune overactivity, at about day 8, a lot of times what'll happen is people will they'll feel yucky when they first come down with it, and then they will start to feel better, towards the end of the week, and they think, okay, well, yeah, maybe I'm getting over it. And then what happens is about day 8, they hit that inflammatory phase. And when they hit that inflammatory phase, then all of a sudden they feel worse. And so if you find yourself on a trajectory where you feel like you're getting better, and then about day 8, you hit that inflammatory phase and you feel like you're getting worse. I don't necessarily think about that time, that's not Paxlovid rebound. And we were seeing rebound before Paxlovid was even a thing. That's your immune system switching from I'm fighting off the virus to guess what, everything in your body's just going to go on fire. And so at our house, we already have very overactive immune systems in terms of we have predispositions of immune dysregulation. We have some parts of the immune system that are overactive and some parts of the immune system that are underactive, but we deal with a significant amount of histamine and a significant amount of autoimmunity. So at my house, after we're done with our Paxlovid, about day 8, and I have these in baggies because I have them out for each person, we will be using azithromycin and we'll be using a prednisone taper. And we're not using azithromycin to treat COVID, obviously, because azithromycin is an antibiotic and COVID is a virus. What azithromycin is an anti-inflammatory as well. There's a lot of anti-inflammatory properties specifically of azithromycin. And then the other thing it does is it can prevent you from, developing any kind of pneumonia if you do end up with that hacky, nasty cough or chest congestion. But we use azithromycin already periodically if we have flares of our autoimmunity. So we are going to be using a course of azithromycin with a 14-day steroid taper for the people at my house to prevent that, immune system flare from perpetuating. And so steroids in COVID infections, especially severe COVID infections, are not new. They are a tool, but you don't want to use them in the first week, because if you use them in the first week, then you're hindering your body's ability to fight off the virus as it replicates. You want to wait that out. And then if you have this kind of predisposition and you have access, then you can hit the anti-inflammatories or hit the steroids, about day 8 or right past day 8. So I think that's most of the script meds that I have in my box. And everything else that I'm going to talk to you about today is going to be the everything else that I'm going to talk to you about today, I think you can just pick up. I could be wrong, but I think it is. I'm just going to look in the chat here. Question on metformin: was it immediate release? I think this is different than you can get on life extensions, where I originally got this RX. Um, that's a really good question. I wasn't paying super attention. I do think it was immediate release though, because I think they were taking it, they're taking it twice a day. So I think it probably was. Um, Nattokinase is safer and more effective alternative to aspirin. I mean, I don't know that nattokinase necessarily is safer than aspirin, because I really don't think aspirin's very unsafe. But we do have experience, seeing nattokinase used as an anticoagulant in long COVID, and I don't think nattokinase is a bad idea either. I mean, aspirin's cheaper. It's readily available. We have it around our house. Some of us at our house take it just kind of regularly as an anti-inflammatory. So we'll probably stick with aspirin, but nattokinase is not a bad idea. Can you spell the azithromycin? Oh, thank you. Someone did. Appreciate that. Okay. So this is kind of what we will do in my house. And again, like I said, most of these things are not going to be now, are not going to be prescription. So when we're talking about that first week of viral replication, we're going to be hitting the elderberry pretty hard. Elderberry is kind of a known antiviral herb. It's been around a really long time. It stops viral adhesion in the back of your throat. So it's actually useful for things like flu and other common cold viruses as well. So as soon as we start to feel like we're coming down with something, then we are grabbing the elderberry. The adults are taking half a teaspoon at least 4 times a day, and the kids are taking a quarter teaspoon. Which reminds me that in my COVID box, I also have measuring spoons. In my COVID box, I also have little measuring cups. So don't forget to make sure that you have the right kind of dispensers for whatever medication that you're taking, because having these things in your COVID box will be helpful. And then can you see me show the measuring spoons, or just looking at my page? I don't know. You can see the measuring spoons? Okay, great. Thanks. I know, like I said, Zoom's changed. I'm not sure. Okay. And then for the first week, we're going to be using X-Clear nasal spray. Now, you guys know that I'm a big Prophy fan, and that I do use Prophy for prophylaxis, because I think it has really good evidence for it as a barrier. And I know that it does trap and kill as well. And the Prophy guys would disagree with me. They would say, no, you can still use Prophy once you get COVID. But I don't know, somehow in my head, Prophy and the gelatin and the way that it works for me is more about trapping and stopping it from coming in. Once it's come in to my mucous membranes, then I'm probably switching to X-Clear, which is the xylitol and the grapefruit seed extract. It's really the grapefruit seed extract that I know that kills just about everything. And so if I'm actually treating virus that, has already kind of come in, settled in, I'm going to be using the X-Clear nasal spray. Oh, I did forget my other nasal sprays too. And we do have in our COVID boxes, we have azolastine, because we also take that just regularly. And we have fluticasone. I would use the azolastine too, just as we go. There's there's studies that it's preventative. There's studies that it can actually kind of help you fight it off. Plus, if you've ever had a stuffy nose and used azolastine, then it really helps. It's an antihistamine. So I would be using this also from the get-go. Now, I would be probably spacing out the azolastine and the xylitol, maybe kind of alternating them, because this is going to help kind of soothe my nasal passages and open them up. And the xylitol is just killing the virus, but I wouldn't want the xylitol to stop the azolastine from hitting my tissue. So I'd probably kind of alternate that. I also have the fluticasone, which is a steroid that also helps open your nasal passages. So I'm not going to use this in the first week, because again, I want all my immune system and stuff to be focused on fighting and reducing viral load the first week. And then I would probably start this if I was still feeling really congested or stuffy, after day 7. The fluticasone. And the same thing, kind of with my steroid inhalers. So some people in our family have asthma. other like exercise induced asthma. Other people in our family, have some other kind of like inflammatory lung kind of things. So we do have inhalers, and I would definitely have the inhalers in the COVID box. Now, if I can't breathe and I need an inhaler, obviously I'm taking it during that first week, just because breathing, you have to breathe. That's your first. If your mitochondria can't get oxygen, then you can't fight off the virus. But if I'm not like in dire need and I'm breathing okay, I'm not going to be hitting an inhaler, especially in that first week if I can help it. Because again, that's going to, make it a little bit harder for me to fight stuff off. But if I need it, it's there. It's definitely, if it's going to help me oxygenate, we do have these in our COVID box. Which also brings me again to everybody kind of knows about the pulse ox, right? And everyone will have a pulse ox, and everybody knows that if your pulse ox is dropping below 90, you definitely need to be kind of heading in to get more medical care. Really you want it to be a little bit, at least mid to high 90s, but below 90, if you're dropping in the 80s pretty consistently, then your body's not getting the oxygenation that it needs, and you should have something checked off. But what you might not have thought about, and you might not know, if you don't deal with respiratory things, these are super cheap. And these are spirometers. They're just, we call them the blow meters, but you can take this and you can, take a huff and blow, and it will tell you like what your normal expiratory volume is on here. And then if you know that, so if you know that you're normally blowing at a, 350 or something, and then you start to feel like you can't breathe, and some of us need kind of reassurance we still can breathe, because we're also going to be really anxious about whether or not we can breathe. And COVID's also going to bring up that anxiety, the histamine level, which is going to bring up the anxiety level. Because anytime your histamine raises, your anxiety level will raise too. Here's kind of an objective measure too. If you're normally blowing 350 or 400, and now all of a sudden you can only blow out like 150, then you might be getting into some respiratory trouble, and you probably need to kind of head in for more help. And these things are kind of cheap. You can get them on Amazon, and you can practice. You can use them even for lung exercise. They make the really funny looking ones that you blow after surgery to kind of get your lung capacity, back. But these are for people who kind of have asthma or other kind of lung things to kind of practice with. So I keep it around. Actually, we don't keep this in our COVID box. We have it out with our regular first aid supplies, but you could blow it a couple times, write down what your normal measurement is, and keep it in your COVID box for extra reassurance if you thought you were having problems. Now, and then of course, I've got thermometers in my COVID box. I've got pulse oxes, thermometers, measuring cups, the spirometer thing. It's terms of like paraphernalia. And this is not on my list, but I'm going to stop my share, and I'm going to show you something else that I have in my COVID box that may not be kind of a typical thing for people to have in their COVID box. And what I have in my COVID box is I have a piece of wool flannel, and I have some castor oil, and I also have some plastic wrap, because I know from other kinds of respiratory things, if your lungs are really struggling and they're junky and they're burning, you can basically get a bowl, and you can douse your wool in castor oil, and you can plaster that on your chest. And then if you cover it with plastic wrap so you don't get your shirt or whatever it is dirty that you're using, and then you take your heating pad, it's also in my COVID box, and you put it on top of that plastic wrap, and you heat that castor oil up. That will act as an anti-inflammatory, and it will help you breathe. And so it's just, that's something that we've done whenever the kiddos have been gunky or yucky in the past. It's something that actually in my midwifery days I picked up. But castor oil as an anti-inflammatory, and especially as a respiratory anti-inflammatory, can work really, really well. So our COVID box also has the big bottle of castor oil and some wool flannel for that process. And no, I don't have a study referencing using castor oil as an anti-inflammatory, although I'm sure you can PubMed just about anything. Somebody's looked at it. But I do love a good hot castor oil wrap for anti-inflammatory. So it's going to share that with you guys as something that you might not necessarily have. The other thing that I was going to share with you guys, if you are into herbals, there is a Booner herbal formula for COVID. And before PAX was out, a lot of people were going with what herbals that we knew could kind of help as antivirals. And I don't know if you're familiar with Booner's work, but he's dead now, but he had a lot of experience using herbs as antivirals and anti-inflammatories, and you can look him up. He's got many books, a lot of them in the tick-borne arena, but some just and as general references. And so I was going to show you here. You can still get the Booner CV, which was, I think, for coronavirus, but you can still get the Booner Pan Kit CV1, CV2, and CV3 formulas. And then they also had recommended for COVID that you combine it with something called Bone Set. And so I don't have this in everybody's COVID box, but my kiddo whose B cells are turned off. And so she needs all the antiviral support that she can get, because even though she has some autoimmunity, she also has trouble fighting things off. She has a set of the Booner herbs in her kit, along with a little cheat sheet here for what she's supposed to take and how she's supposed to take it. And so it's 30 drops of bone set once a day, and then 1 teaspoon of each of the other bottles 4 times a day is the recommended dosing for adult sized person for the Booner formula. So if you are into herbs, this is actually from a place called Woodland Essence, and that's where mine come from. And that is in her particular COVID box for her because we feel like she needs kind of an extra oomph and support along with the Paxlovid and the metformin and the Luvox and all the other things that we're doing. We're going to have her on an herbal regimen. So what else is in my COVID box? I'll just pop my document here back up. So vitamin C, and I have vitamin C in baggies with the amount written on the baggie for how much each person is supposed to take. That's another place where your measuring spoons are going to come in handy, because if you're taking high dose vitamin C, of course you can get it in pills if you want to swallow pills. But you can also get it in powder, and then you can mix it in some kind of drink. Which again, the two things that are most important. The first thing is rest. The second thing is hydrate, hydrate, hydrate. You want to hydrate when you have COVID because that's going to, help you thin out your mucus and help your liver and your kidneys, and be able to detox all the stuff that those inflammatory chemicals that your bodies are producing. We also have Potsy's in my house, but I think everyone should have some kind of hydration. Whether it's noon, we have noon tablets, we have liquid IV tablets as well. But there should be, packets as well. Some people just use Gatorade. Some people use the homemade honey kind of electrolyte formula with salt, but definitely make sure that you've got something with electrolytes in there that's hydrating. And if you're a potsy, you really want to make sure that you've got a lot of your electrolyte support on hand as well. Vitamin C, vitamin D, and then and those are pretty self-explanatory. And then we have little baggies too that have our black cumin seed oil in here. And you can get it in liquid or you can get it in gel caps. Like we prefer the gel caps. Black cumin seed oil is an anti-inflammatory. It's also an antihistamine and it's a mast cell stabilizer. And there's a lot of good evidence for black cumin seed oil in these kind of arenas. It also has some anti-seizure activity. People who do have seizures or who have a predisposition to seizures, COVID tends to make their seizures worse. But black cumin seed oil as a gentle anti-inflammatory is a good idea. You don't want to overdo the black cumin seed oil. It is a little bit estrogenic for people who have any kind of hormonal flux. But at these doses, you shouldn't have a problem with the black seed oil, and it's easy to get as well. Let's see. Saw something pop here in the chat. How do you spell his name? Booner. It's Buhner. And then there's an electrolyte recommendation there in the chat. All right, and then of course you can take quercetin. That's another thing that a lot of our mast cell and histamine people should be familiar with. And their adults will take 250, and children, twice a day, and children will take 250 once a day. And then there's melatonin. Melatonin, not for sleep. This is an anti-inflammatory dose of melatonin, Melatonin at lower doses can, be sleep inducing. That's where most people know it from. But melatonin at higher doses works as an anti-inflammatory. I actually do have references for that I could have thrown in here. For the adults and teens post puberty in your house, you don't want to really do this before puberty just because there is some hormonal interaction with melatonin for those kiddos that are going through puberty or pre-puberty. But post-puberty, we're going to be taking 20 milligrams in the morning and 30 milligrams at bedtime as an anti-inflammatory, not as a sleep aid. And then zinc is also super important. It's a cofactor in a lot of things that help you fight off viruses as well as your mitofunction and other things. So the adults in my house will take 45 milligrams daily. The kids will take 30. Already talked about the aspirin. Then now we're coming to one of my favorites here. So I just want you to look at my NAC because this stuff is awesome. Now, don't be confused by this brand. Do not take the 600 milligram capsule brand of the Now version because that makes people's tummy hurt. But the 1,000 milligram tablets are really, really good and it's pretty cost effective. You can also get pure formulas or other brands. But NAC is amazing. NAC is a sulfur donor. So what it does is it supports your liver and your kidneys. At the same time, it's also anti-mucogenic, so it will thin the mucus as well, and it has an anti-inflammatory effect. It's an antioxidant, so it supports your mitochondria. So if you don't have NAC on your daily supplement page, you should definitely be taking it while you have COVID. I actually think NAC's good for like most people as long as you can handle sulfur donors. So NAC's one of my big, we want to make sure we have plenty of NAC when we have COVID. And then probiotics. So we all have a probiotic in a bag. There were studies showing that just plain old culturelle probiotics would actually help with COVID. We also like the BioCult brand, but making sure that you have a probiotic on board would be something that we would have in our COVID boxes. What was the thing I said about the 600 versus 1,000? I said that the Now brand get the 1,000 milligram tablets instead of the 600 milligram capsules because the 600 milligram capsules in the Now brand tend to hurt people's tummies. I don't know. There's something in them that tends to make people kind of get sulfur burps and hurt their tummy. But these are tablets, and this is what we use. It's the most cost-effective option that we found. There is also a 900 milligram capsule from Pure Formulas that is really good to work with as well. Or there's other good brands like Seeking Health or even Jarrow has a pretty good NAC. Kids are going to do 500 milligrams twice a day. Adults are going to do 1,000 if you're not taking it. If you're taking it, just double the dose that you're normally taking it for COVID, or at least that's what we'll do at my house. Now, I'm also going to tell you about another, what I think is one of the kind of most underrated tools for dealing with COVID. So COVID and histamine, right? COVID will make your body release a lot of histamine. If you already have allergies or you're already atopic, eczema, mast cell issues, COVID will kind of exacerbate those with its histamine release. And so you want to make sure whatever your preferred H1 blocker is, that's just Benadryl for people who aren't normally on it, but some people are also on hydroxyzine or other kinds of H1 blockers. Now you can use a long-acting H1 blocker if you want. At my house, we even layer them. We do like a Zyrtec, which is a long-acting, and then we do the Benadryl, which is a short-acting for more acute things for shorter periods of time. And then you want, that's H1 receptor, your histamine receptor 1. And then you want to take like a Pepcid or a Tagamet, which is your histamine receptor 2. So your Benadryl is going to block histamine receptor 1. Your Pepcid is going to block histamine receptor 2. And then at my house, we use DAO. DAO is a histamine degrading enzyme. It lives in your stomach regularly. And anytime a protein breaks down, it makes histamine. And so we all have histamines in our foods, and we also have histamines that our body produces. And DAO processes both estrogen and histamine in your tummy. And so taking DAO with meals or during periods of high histamine can also lower your histamine load. So particularly during COVID, I want H1 on board, I want H2 on board, I want my DAO on board, and then I want mast cell stabilization, which the quercetin that I mentioned earlier is a mast cell stabilizer. My favorite mast cell stabilizer, well, I have two, but my favorite acute mast cell stabilizer is it's DAO, Suzanne, for DAO. It's diamine oxidase. This brand is this is histamine block. Seeking Health also has another one. There's actually a pea protein derived one. This is porcine derived, but you can get DAO, DAO. PEA. I love PEA. I think PEA is wonderful. PEA is a lipid molecule that does occur in your bodies, but what it does is it actually blocks pain transmission from other parts of your body to your brain, and it works as an antihistamine. It works as a mast cell stabilizer, I really, really love PEA, and it also does really great this liquid formula, which unfortunately I haven't imported this since all the tariff nonsense and everything because I keep it kind of on hand. This is an Italian formula called Gallia, and it's available from online from somewhere called Farmacia Loreto. And this works really well for GI distress if you're getting tummy aches or diarrhea, and particularly during COVID. That's why I have bottles saved in our COVID boxes for this liquid PEA. It's I think a lot stronger and really good for GI stuff. But they do have a domestically available brand called Nootropics that's also really good. And Nootropics comes in capsules, and you can take that. And adults would take 800 milligrams 3 times a day, and kiddos would take 400 milligrams 3 times a day. And it's really, really good. Now, you do have to be kind of picky about your brand on the PEA because, like Miraca PEA, doesn't usually work. It's kind of a famous, popular PEA brand, and Miraca PEA a lot of times just doesn't really seem as effective. But this Nootropics brand is good. The Gallia is the bomb. But you have to import it, so you have to go through the extra hoops. And I don't know what the tariffs have done to it. It is from Italy, though, so at least it's not one of the heavily tariffed places. All right. Back to my list here. I'll flip you guys back over and share my screen again. Um, there's your nattokinase. You can definitely take 1 capsule of nattokinase. We had kind of talked about that. I don't actually have the nattokinase in my COVID box. I just have the aspirin, but it is on my list of stuff that could definitely be in my COVID box. And then packs, and then the prescriptions for like Tessalon pearls and stuff. So actually, I think that is everything that I wrote down. So if there's something that I said or that I say now moving forward that wasn't on this list and you want me to put it on there, just hit it in the chat and I'll make sure and put it on the list. Okay, so someone's in here typing blue sky threads in here. Oh, about the antihistamines and stuff. Okay. Yep. Yep, that's good. Histamine reference. Okay. So what else is in my COVID box that I didn't write down for you guys? There are still a few things in my COVID box that we haven't seen. There's just all your regular kind of cough syrups. Mucinex seems to be the one, or even generic Mucinex that people really tout as helpful with COVID, with the mucousy and the cough stuff too. And they do have the children's Mucinex or the grown-ups Mucinex. And I'm all about some good cough syrup that doesn't have Tylenol in it. You really do want to try to avoid Tylenol while you have COVID, just because Tylenol does deplete your glutathione, and having COVID in and of itself will deplete your glutathione. And glutathione is your body's major antioxidant. It's your body's major detox chemical. And so you don't want to try to stress that out. It's one of the reasons why we take NAC, to keep the glutathione levels up. And so I like me some cough syrup that doesn't have the Tylenol in it if I can. And the Mucinex seems to be the one that works really well to kind of dry stuff up and stop the cough. Now, that being said, and me preaching about the Tylenol, I do have some severe nighttime cold and flu NyQuil that does have Tylenol in it if I get super desperate and I can't sleep. I'm going to try to avoid it, but again, not sleeping is kind of the nemesis of healing when we're talking about COVID. We need to be sleeping a whole lot, and we need to be also hydrating. And so, if I just absolutely can't sleep for a really long period of time, then I might try to knock myself out with the NyQuil, even though it does have a little bit of the Tylenol in it. I do have my good old Vicks Vapor Rub. There are also natural versions of this you can use with wintergreen oil and beeswax and all of that if you're it. I'm not quite that purist. I'm okay with a little petroleum jelly every now and then. And so just the Vapor Rub, we find opens your nasal passages and kind of, I don't know, it's kind of comforting. Speaking of glutathione, you can directly supplement your glutathione as well. So in our COVID box, we have several different ways that we can do that. There's actually 3 different forms of glutathione that are pretty easily available. Trying to find my third one. Here it is. So there's nano glutathione drops. They taste nasty, but they will help your glutathione raise, and I do have laboratory evidence to prove it. There are clinical glutathione lozenges. And then I don't know, this is Patch MD, and they used to have this glutathione plus patch, and it's 500 milligrams of glutathione. Now, I haven't been able to find these lately. I've only found like 50 milligram patches, and so you'd have to wear like 10 of them to get what we used to know what I know will work by labs. Um, but if you just can't stomach the idea of, because glutathione it's a strong sulfur kind of taste or smell. There's also Quicksilver glutathione, which is another good glutathione brand. And then there's Designs for Health glutathione, which is also the key with glutathione is you don't want it to be in a capsule that you're swallowing, because going through your stomach acid in your digestive tract does not really do well with its bioavailability. You want it to be something that's going to be a drop or dissolve in your mouth, or a spray that you can put in your cheek pocket, or like I said, you can use the patches. We do have before and after labs showing this will bring glutathione up as well if you can find the patches. But having some kind of glutathione also helps. And then if you happen to have to take your old NyQuil with the Tylenol that depletes the glutathione, you are supplementing your glutathione and your NAC, so you're kind of offsetting that risk if you can. But we do have different kinds of glutathione in our COVID box. I also have like kind of kids honey cough syrups and stuff, just because kids are not always super excited about taking the medicinally kind of ones. And this brand here, this Maddie's, this is a good night cough syrup. It's got some like lavender and hops and some other kind of calming herbs in it, and it does have some of the soothing cough stuff in it as well. So that's in my COVID box for the kiddos. I also do have the children's Dimetapp cough and cold. In my experience, you just kind of never know which one for which viral illness is going to work the best when you're talking about coughs and respiratory stuff. So I like to have some options. And again, sometimes I'll layer them, take Dimetapp, every 4 hours or so, and then you can have some honey in between. And that tends to work well for us. For GI distress, this is really a secret weapon. And this is not COVID specific. This works well for just about any kind of GI distress. This is marshmallow root extract, and I get like the bulk supplements brand. Have I just got you off my screen? I do. Okay. Marshmallow root extract and slippery elm root extract. These things, if you just take a couple of teaspoons of each in some applesauce, it really soothes the GI tract. It actually works like an anti-inflammatory, and it actually stimulates the mucus in the GI tract. It will stop diarrhea. It will stop kind of crampy, spasmodic things. And so, there is a flavor of COVID that comes with a lot of GI symptoms. And so having my slippery elm and marshmallow root in our COVID box is important in case we run into like the gastro kind. We also do have Zofran. I forgot about that in turn when I was talking about prescriptions, but I do have some Zofran in our COVID boxes for vomiting. I also have ginger tabs for nausea and vomiting as well, because nausea and vomiting can be part of the COVID constellation. I also have, just in terms of basic things, I have bags of cough drops. Our favorite, we like Ricola, but I've got cough drops in here. And then I have these Lollies sore throat lollipops. And these work really good for the kids. There's also the, razor blade throat brand of COVID. We don't ever know which brand of COVID we're going to get. Are we getting respiratory COVID, GI COVID, sore razor blade throat COVID? So we kind of have to kind of cover our bases. Debilitating headache COVID, and it could be different even for different people in the same family. I mean, I may have the debilitating headache COVID, and it may be a sore throat COVID for my kiddos. So we all have some of these sore throat lollipops in here. And one of my kiddos really swears by these scented, inhalers. They're like scented Vicks inhalers. He has kind of sinus issues kind of chronically, and he really likes those. So I have those in his COVID box. That's it. Everyone doesn't have to have exactly the same thing in their COVID box. You can have a little bit of different things in people's COVID box. My Potsy, who's got POTS pretty severely, has also not just her electrolyte drink. She also has her electrolyte tablets. We use salt sticks, and those are, oh no, this is Vitacium, sorry. Vitacium salt sticks. So we use those for her. She has extra in her COVID box for when that happens. And then, don't forget to have your instructions in your COVID box because you don't want to be trying to figure out what you're doing with all this stuff while you're sick and brain foggy from COVID. So, I mean, just as simple as a handwritten piece of paper. This right here, this is for one of my kiddos. It says vitamin D, one per day, black cumin seed twice a day, NAC twice a day, vitamin C, quarter of a teaspoon. It says, she has her like morning and then she has her night written out here. And then as needed, the Tessalon pearls, the cough syrup, the Vicks vapor rub, the azolastine. And then she says she has her herb drops written here in the center. And then it says Pred schedule on the back starts on day 7. And then she has her steroid taper written down. So like making sure that you have that ahead of time and also having, a pen and a notebook in your COVID box that you can keep track of your symptoms and when you're taking medications. Because if you're sleeping a lot, you also probably want to set alarms in your phone if you've got some stuff that you're taking scheduled, but you want to be jotting down things. You don't want to be trying to remember what you're doing in the moment. And so I think that pretty much covers everything that I have in my COVID box. Trying to look and make sure. Oh, and everyone, of course, should have masks in their COVID box, right? Make sure you have extra supply of masks. So as you isolate your family member, and you might have to run out to go grab something, grab your Paxlovid from the pharmacy or whatever it is. Make sure that you've got extra supplies of masks in your box to try to keep yourself and other family members safe. Oh, and one last thing. This is my dear friend Mullen. Mullen drops for respiratory things are really, really, really good. We used to use them actually with babies with like respiratory stuff when I was a midwife. And Mullen is also, it was safe during pregnancy for the pregnant women. But Mullen's a really good herb for, taking care of gunky lungs and cough too. So you can see that my COVID box is a little bit of a conglomeration of prescription medications, herbal medications, and then targeted symptom specific kinds of things and relief. But I just knew that I needed to kind of update and reorganize, and I still have to reorganize because I pulled it all apart to show you guys, and now I have to kind of get it all back together. But I do think that having these things on hand can make a big difference for how well we weather the COVID storm, and then to try to help us keep the inflammation under control so that we have our best odds of kind of beating the long COVID and when that comes around. Now, I have to always say that I am actually, I'm on Ko-fi now here. We have our Still COVIDing and Beyond page on Ko-fi, which is also, tied into our new forum access. We are trending towards trying to downregulate our Meta presence and our Facebook presence. And that's not saying that it's going away anytime soon or anything like that, but it's just saying that, we want to do our best to kind of try to transition to our own space in the forum. And we also, we kind of want to be off the Meta platform eventually as we go, because it's just not a really safe or great place to be. So if you can, if you like, if this is helpful to you and you can subscribe to the Ko-fi, then I will be doing some of these things for Ko-fi supporters only, but then I will also always have, free and public available comments. Public available content as well, because we want to get it out there. But this also helps us maintain our forums. It helps me be able to keep kind of doing some of the stuff that I'm doing as well. So if you're moved or you like the content, please pop over here. Regardless, please pop over to the forum and make sure that you're signed up there, because you will eventually, not yet, but you will eventually start missing some things if you're not on the forum, because we really want to try to get people to come over into our space that's not controlled by kind of external forces, and that's a little bit safer for us to talk about some of the things that we like to talk about. So that being said, I think that's all I have for my actual kind of didactic portion here. So I'm totally willing to let's finish up what we have here in the chat. Do we have tips for getting PCPs to prescribe the meds you went over for COVID? Do you have a write-up that you use? Do you ask for these things in advance? I find most doctors are not very informed on the latest research. That is absolutely true. Most doctors now are just like, it's like a cold, right? Oh, well. Oh, you got long COVID. I'm really sorry. Maybe go to a specialty clinic. So tips for getting the PCP to prescribe the meds. First of all, if you go in kind of knowing what you want in your dose and you're very, very nice about it, if you go in and demand it, then they're already looking at you as a liability and they're not going to help you. So hopefully you have a very empathetic medical provider that's your like PCP and they kind of knows you and you can talk to them about, what your concerns are and get some of the medications on board. But if you can't do that, then coming in and asking for some of these medications to hold, I might, bring I don't know, doctors are such fickle creatures in terms of like their egos and whether or not they want to see the research or they don't want to see the research. And, kind of, would say yes, maybe not, maybe print a couple of abstracts to take in. We could put together, definitely put together like a one-page handout for, what to do. The best thing is to try to find a knowledgeable provider that you can work with. And if you can't, then you might use some of the teledoc services because sometimes the teledoc services are just set up to give you service for what you want. They're not necessarily here to really kind of follow you long term. And so they're not as kind of as picky as somebody who might feel like he's setting a precedent for his whole like medical practice moving forward. So I do find that that can be a struggle. It's one of the reasons why, the where I work at our clinics, we try really hard to give good access to people because there's not a lot of people, a lot of doctors that kind of stay up on this stuff. I'm thinking about the 10-day trial for Paxlovid. Most docs only prescribe for 5 days. And not sure that there's still, yes, you could use chatbots online. You can use the online services and kind of double dip sometimes, or you can also like I said, maybe you thought you were going to have COVID, but then you decided you didn't have COVID and your Paxlovid kind of stayed in your box. And then, oh, you're really sure you have it now. So now you need a script for COVID. And then all of a sudden you have your 10-day scripts. Medical access is a real issue. It's been a real issue, even before COVID. And now that COVID's hit, not only access to research, access to, providers are swamped too, guys. The healthcare system, our healthcare system is not made to support patients or providers in the way that they really need to be supported, especially when it's around kind of a hot button topic like COVID can be. It can be a little bit difficult, but there are ways to find providers. There are kind of the docs in a box or the online prescription services now. There are some international prescription services with kind of built-in docs that will write you for things. Now, Pax is one of the things that is expensive and it's not really that kind of available. You really do kind of have to have a provider. I think there are still some online scripting services. I don't know about how like insurance coverage will be for those, but some of the other things like metformin's pretty cheap, and so is Luvox. They're not like expensive drugs. Tessalon pearls, no one should have a problem writing for you. Your steroids are, again, those are kind of cheap, old school kind of drugs. So like, as long as you're not asking for something that's really kind of way out there, you could even go in for, adults and be like, hey, I'd like to try a low dose of metformin for anti-aging. And there are a lot of docs that are like, oh yeah, metformin for anti-aging. I've heard of that. And they'll write your metformin for anti-aging. And then, you can keep it and use it for post-COVID. Yeah, I can share the doc that I'm referencing. I'll be putting that up in the forum for sure. And I'll also put the video up here as well. So I'm going to go ahead and turn the recording off. I want to thank everybody for watching, and please let us know. We can continue this chat in the groups and certainly on the forum.